Singen med rogo itiar morensinga superstation WWFM the lutan me ko tera mlitiul le la sit sinetiul ko singilo ngetiul buila solar ko di 2 more days away from September 11. Anyway, marungil ko singe sola me pok pesquisa gel technical information na make a few adjustment tra tial broadcaster gid live remotely live mangoteg da teletel el ang callback el ding wargit 488-4848. El ase ang aramos el low ringing murang la radio mtimoti atring spulue. Mergoya direct tara akira del momtang lide lang mamtian lamo la testa igir rogui esola elatia live as we are talking, the whole world is watching and listening. Mangkom imo aware ngi lo ase tial angaramo nga kimle recorder ngi or top ngi ra Facebook rate or 2 days later taiga gidele YouTube ndi elandia live belgula amra se sel dongo do ngi atto dra blulat torrens nga bek ngi ra nga tel blulat direct close timing live ra MBTV ra channel 26 direct live ra radio WWFM ra 88.5 ma 89.5 direct live ra Eco Palau tagi joint broadcaster tagi the program ra updating ra buhay lo ka EOC na Ministry of Health and Human Services. Otherwise so live malungil ko singel mergi rogi kultur ek mo Michael Mumsang kafar bolo mo ra program ligi ra ko singay kafar.
Always kamal sulang tulig malungil ko singel morgaw ma ra Diaz broadcasting. Direct kaling utet al obangge meman bring asuli adra ngarel belaw obangge selbek temela talk show joint broadcast.
I say
limring asuli malu kera bekla no sabil me join gid al gasus bring raungil kopsingen marabekla tuli kayong mal merungud lo ay sila set tokar guest gid al gasus.
Okay.
Dr. Thane Hancock, Dr. Haley Cash, thank you once again for joining us this week. The third talk show for you guys to join us. So we thank you. I think this is the last talk show, but certainly if you do ever come back, hopefully when the pandemic is over for other things, we can get you back on the air and join us for other topics. But the tegi de amo mongora lobong le tulig lobong tri tiga terut tokta magdaman meringa sulil tamlamo edel Sunday lobong get magdamal merungu de meringa sulil leng tamle deploy mail gidel dimle erul Sunday and apple by mlo subi idel extend magda meringa sulil mutal tara Sunday sibilo mlo subi lobong get me obong get la talk show. Sisil time perungu dalo ay sila sa ngatiang ugurdeo Dr. Patrick Tellei do tang lilbekla del pong president tra Palau Community College ndi o sisil time member sel National Emergency Committee NEC.
Okay.
Nga sulen nga ruba kan sa BL me bangedel algosus direct lo bangela Mr. Olkeriil Kazuo direct member NEC nga do tang lil nga ra Ministry of Finance direct adal tial MHHS EOC the COVID-19 response mga meringa sulit trigat teruduba. Of course, as always, Olkeriil Algasus, Incident Commander EOC Liter Udoy, madirect PIO Chief Adol Migardeo. Talk show gide Olkeriil Algasus, as always, kadomo sa telela Incident Commander maskita updates na kuk Tellei real namgatmok since last week talk show gid and then kada mastria te al tirgat teruruba kamatuguk mo o maklat kergid.
Okay.
Maklat kergid regel gukora Tellei real togunigel tokora omarain mesois revelaw sa edel gora kayong seora dalong lete to kala de tuligel may kita mninga sa kanya dastal turist el mendi akumda sa omasindra adal mayor atadel marangaligel el may olding el marmerar wa alsang mga rakken mong malungil kuk kateal da kay nga selbekla del kaklat kala kuk aygel luudre la time ra tokorar wa a restriction of movement ma aygel rokuil kita olingitra a travelers el mesois mato toltirakla mang moy sa ida Tellei la talk show tuli ka tel mlakmu igel technical aspects mal sugo mga niya callers en mal sebedel silmi mo klom mo dol le korga okay re kita malas mlonge regel el questions di
Okay.
always sek mun masa TL masa incident commander mbolo mura program labang o basa igil updates.
Okay. Sila ang kapar.
Wilgab sanget tulir.
Ikot na
Makadamu al smooth tistigal ungay legay sergil sadara last week tisegil tilgay Peru ngamla mo ngilem la test la tubadara isolation hindi nga rin gay imong al lumade al close contact ang gadir ka malamol Michael Calcel al mangara isolation facility Sunday nga mo mga true club seringi mga damo o tester ngi yal su mang negative ang tov dal mora ablu adara surveillance malamol mal checker ngi rabe Calcel alom ko dongar ngi ang gora dia ka symptoms ringi malmasisi makadadi mengiler segi del Sunday el mutel motes ringi.
Okay.
Sulgok tungura omrus ayegi del up to last week era September 4 last del omrus segi del Sabadong kadang la ura trigel fully vaccinated amlam yakwel mo 15,647
I see.
ngara 80 talgibel talgibel pro 89% tra total population and this el wukay gel kora kumakay so de gel na lour trigel adults trigel 18 na kril morbaba 14,872 amlam Michael first dose certir.
Okay.
14,560 amlam Michael second dose. Ang bukor da level dartal aga diril me malaya gel second dose certir trigel 18 na kril morbab. Trigal wuk magikaril ngal ka 1,269 amlam first dose certir. 1,087 amlam maya second dose.
Okay.
Gigil almost ngara erul darta amate algiril memrus ay gigil umrus ay gigil bleda announce la civil wasay ngaringia September 17 ma September 24.
Okay.
September 17 ngaring gigil sa Pfizer matamira erul dose ya September 24 ngaringa memla second dose tira Moderna ma Pfizer.
I see.
Ma gigil mo moda kay gilo urea agigidal adult fully vaccinated 14,560 again adolescent 1,087 mo 15,647
Mas riter ngeral advice o mas kamam aradra blu tiagidil ngaria accessibility gidil mo sois para social media tirgal highly educated ngarba toktang ramrigel ma kongres ramrigel na mo titang rat mula sila mo laringi litiam kam taskeli mga bitang mundiak mo laringi ang kami ngaral advice o mas kama other belaw na mo klo adaktra rang mamel malat yang litakaw titang tigar expert magay titang leg yakada betul ke elang kita fauci el abdullah sega girel fire ma el ngarbabel adel kongres ramrigel adul wai semang magtakti ngaral advice o mas kama tolmol mo reng sir kami mo reng sra Tel EOC, I mean, la World Health Organization, CDC, pas kamama ko advice mo mo klarang ma'am.
Ang waise tulir, kada dira kalma diolong itrara bulu, ulita kaloreng, mutaka ngal mal dioreng sa yel toko el tudra Ministry of Health and Human Services. Kama dira kal ngara EOC, dira kal diyan magidira ko nga arwa Facebook dira kalomesa patokal toko el medum diga madira kalmal diltu ila ara ayigidel kora advice maluben guidance lo maskida WHO ma CDC
okay
mga gidira kalmal mga lerara adra blula sila kamatakte may mga oros ay gidatal lang 15,000 adra bela am lamrus dilka kada betigan ni ngaringi akora amlam kasak raiga rorusel malmo koras me mo erura kodal malubet tamlama dara aiga lorusel el blatangay.
Man sabihin mo luwasya dolomol mo loreng sirgamiu legamiu amala of aigel official malupen scientific facts from CDC and kimoreng sirgamiu di nakadoreng sa Facebook maigal social media.
Ngay se tuliga ulma gidira kalmalmol may gidel talk show gidra abe kalsande amalong maral wasay ngira del me otob daro fu el information el moral adara blu matamdinge so ngora open line la communication gid mar adara blu al direct kalmo ulang tedel qara manglo arandir ang kau kaga farangar nga ngot alwas emel edaringi anding segi dagi mal qora diolingitra klaing sewra ratrablu ma kaloreng yawasay medaw takangal malmol malmarula yigidel al tokoyel bla imamade qad malgol mer elang ay gidel wal preventive measures alwasay ngaranga sab edel marula qad al masaba aql gidel galbo da ser tegidel raqta
okay hale ka fare ating war kita 488-4848 masugo mga niyang idil adra blulo reng sa umesatyal program. Please kola 488-4848 desay kita lang ang most of ela kafar tirgel arwat Dr. Hancock makas tirgel adatyal MHHS most will answer instead radia sel dabrang rengel blu ang rengel ko mo gergide kat mas kami asabam mas kami wrong information or assumption matagida te alan moger tirgagi tira brute eurol lo informer gidra gerro ko talang tingil itagida the COVID-19 ma-update sirngi. So please send ko na 488-4848 asu mga niya karmiw. Back to you, Kaspar.
So lang ituloy ka direct ronda sa sekalebay lungil do buktoger Dr. Thane since ngay adra CDC ngartelo mangedel am te alal loger tegidel gel morngi I'm sure na sabel director ko ra maskida ko ra bebir information el gedel.
Okay.
So Dr. Thane, the question is there's so many news out there about this the third dose and the booster shot. There's confusion about whether or not we should even get it at this point. There seems to be it's not clear when the timeline is, if we're ever going to get the third dose or the booster shot. So the question is, what can we get? What can we get from that? Who should we listen to, and what advice should we take at this moment?
Yeah, thanks. And did you guys discuss the difference between the additional dose and the booster dose? Do you think that's important to you?
No, we haven't.
Okay, Dr. Hancock, the problem is we don't know who to listen to because the social media right now, the Congress of the United States, the CDC, they're singing different songs and we're confused and they want to fire Dr. Fauci, so who is to listen to?
Yeah, no, it's an excellent question. And so in regards to the booster dose, really who you want to listen to and wait to hear from is FDA and CDC's Advisory Committee for Immunization Practices, or ACIP. And they are the individuals that are really the two groups that are really looking at the safety and efficacy or how well it works, these boosters work. And so it is sort of confusing. It's sort of unusual that a lot of the leadership said, hey, expect boosters would be rolled out. And I think part of that was really to allow jurisdictions, states, and even Palau to start preparing for potential boosters. It takes some effort to spin up those vaccination places and that sort of thing. But really what we want to wait for and what people should look for is the information coming out of FDA and CDC's ACIP. And so going to cdc.gov is going to allow you to get the information after those committees meet. Right now, FDA is reviewing all the information that's been submitted to them to really see if a booster is needed and is safe. There's a lot of rumors back and forth saying, yeah, it looks like potentially there's maybe a booster for Pfizer, and maybe we'll see what happens with Moderna. But that's all guesses until FDA and CDC's ACIP meet and provide that information. And it looks like it's going to be probably around the week of September 20th that they have those sort of final meetings where you'll start being able to find out the accurate information on what will happen. So, yeah, apologies. It is confusing. There's a lot of uncertainty, but just hold tight, wait. Know that your Ministry of Health and Human Services is preparing in case boosters are needed, that they're ready to be able to roll that out quickly for your community if indicated, but really want to fall back on the science to make sure whatever is done for Palau is safe and effective.
Okay, thank you, sir.
And Thane, maybe talk about the messaging from WHO as well, why they're not advising for a third shot or a booster at the moment. Is it because of the actual vaccines, or is it because they feel like not enough people have even gotten the first dose, and then now some countries or some jurisdictions are looking for a booster shot? So is that their main message, or is there something different that WHO might be putting out?
Yeah, I think WHO is looking across the whole world, and whether it's globally, if you live in a country elsewhere, or if you're living in Palau, really the most important vaccination to get is the first and second doses, right? We really want, that's the one that provides you the most coverage against the virus that causes COVID-19 and Delta variant. And so that's an important message to people out in Palau who are not yet vaccinated. Hey, you still have time. It's not too late. If COVID is really spreading around and it infects you, it's too late. And we don't know. I mean, you've seen that there were the 2 cases here. Fortunately, we haven't identified others, but this is a sneaky virus, and you should get vaccinated now if you're not vaccinated. If you've only had 1 dose, you really need to get that second dose. That second dose is way more important than any booster, because we're finding that really helps protect you against the Delta variant. So when WHO brings up, hey, maybe we shouldn't use boosters, they are thinking about those individuals that are not yet vaccinated or have not had the opportunity to be vaccinated.
Okay, Dr. Hancock, here's the question, we have been talking, and discussion has been on Pfizer and Moderna. What about Johnson & Johnson? Haven't heard anything about Johnson & Johnson. So can you explain to us, if those people that got 1 shot from Johnson & Johnson are just as much as safer than those who got Moderna and Pfizer?
Yeah, that's an excellent question. A lot of people are asking, what is the plan for Johnson & Johnson? And there has been some studies that look potentially for people that are immunocompromised, maybe an additional dose would be beneficial, but really that is also being evaluated by the FDA and CDC folks. And so potentially we may hear at the end of September or a few weeks later on what the guidance is for. There's a large number of individuals that have been vaccinated with Johnson & Johnson that may be looking towards a booster. I do want to emphasize, these discussions about boosters is really about trying to ensure that or reduce transmission, but they're finding that these vaccines appear to have maintained their ability to prevent severe illness, hospitalization, and death. Whether you had 1 dose of the Johnson & Johnson or you had complete doses of Moderna or Pfizer, that at least and that's the main thing we want. We don't want people to die from COVID, and those vaccines are still performing remarkably well that way. So for those individuals that have just 1 dose of Johnson & Johnson, I think they can still sleep well at night knowing that they have that good protection against severe illness, hospitalization, and death. But down the road, they too may be asked to get a booster just to really help prevent the chance that you get infected and have mild disease.
Yeah, what I have seen and read on social media, there's no negative comment, in regards to Johnson & Johnson. It's always Pfizer and Moderna. And here we are talking, and we're talking about Moderna and Pfizer instead. And Johnson never mentioned. Maybe for us, like myself, we got 1 shot of Johnson & Johnson. So I feel good when they don't talk about it and no negative comment about it. So I feel safe, and I'm fine. I'm okay. But when you don't mention anything about it, I'm gonna start worrying, like maybe Maybe it's not working or what? Can you say something nice about Johnson & Johnson?
No, I think, Johnson & Johnson certainly is a vaccine that has been used a lot in the islands, and like I said, it appears to have good success at really preventing what we care about most, is that severe illness, hospitalization, and death. And it's nice. It is right now just one shot, and you're finished. But as you mentioned, you see all this data. The vast majority of folks in the U.S. have received an mRNA vaccine, but there's still millions of people that have had the Johnson & Johnson vaccine, and they are looking at those individuals to see that vaccine continues to hold up for them and do well, and it certainly is on the radar of FDA and CDC to make sure that those individuals that have Johnson & Johnson are also having that ability to maintain their immunity or ability to fight COVID-19 going forward.
Thank you, Dr. Hancock. Now I can sleep well tonight.
So Dr. Hancock.
Okay.
So there are some people that got their first doses in way in the early days, like February, March, and for one reason or another did not come back for their second dose. So the question is, can they come back now and get their second dose? Even though it's been how many months since their first dose, or if they come in now, would this serve as their first dose and they'll need to get a second dose or third dose thereafter? So those are questions that have come up. So maybe if you can.
Yeah, those are great questions, and ones that I think come up a lot. The good news is if you got your Moderna or Pfizer dose a while back and you've missed your second dose, it's been beyond 6 weeks. All you need to do is come in and get that second dose. You don't need to go and start the cycle over again. Just getting that second dose is really important to help strengthen your body's ability to really fight the Delta variant. So please, if you got it a month ago, don't worry, you're not necessarily going to have to get 2 in a row or restart. Just come in, get that second dose, get it out of the way, get that extra protection while Delta variants, trying to sneak into Palau. It's great that you protect yourself. And again, for those of you that maybe aren't vaccinated yet, this is the time to get vaccinated and get those 2 doses, that 2 doses going so that you're protected if and when a Delta variant does start sneaking around Palau.
Okay. We're not arguing or debate with you. We just want to repeat what was said to us when we first started this program. When we started this, vaccinated people, we were told that you must get it get the first one, the second one in 21 days. And if you don't do that, you have to go back and repeat the whole process. Is that true?
No, so the reason why they have the recommendations for 21 days or 28 days, depending on the vaccine that you received, those were the dates that they evaluated in their studies and were found to be, okay, this is the fastest way that we can space the vaccine to get people protected. And if you think about it, when there's a threat of this virus coming, you would like to get your immunity scaled up and get your immune system ready to fight as soon as possible. So that's why they had those 2 dates. They didn't really do a lot of studies to see, okay, can we do it at 8 weeks or can we delay it for 6 months? Because they really wanted to ensure that people have that protection as soon as possible. Right now, the CDC recommendation is, and it has been, that if you miss that second dose for whatever reason, just come back in, and at this time, they're saying all you need is that second dose. You don't need to restart. Now, as you know, we're continually evaluating these vaccines, how they're performing, ensuring that they still are incredibly safe, which they are incredibly safe. But so there may be, as we know, potentially a booster coming up. But at this point, if you miss your second dose, don't worry. Come in. All is forgiven. Get that second dose as soon as possible, so you have those good antibodies ready to fight Delta variant.
Okay.
Tuligan haling dira kalpay doger ringil wasay wara situation na Guam. Dr. Hancock, maybe you can share a little bit of the current situation on Guam. There's a lot of comments, on Facebook and with the concerns about hospitalization in Guam being equal parts unvaccinated and vaccinated. So now they're saying, what's the use of getting vaccinated if you're still going to get COVID and you're still going to be in the hospital? I know we've talked about this before, so maybe you can share the current situation on Guam, and then the vaccinated versus unvaccinated are currently infected with the Delta variant on Guam.
And let me add on to that question. Is Guam still on a lockdown?
Yeah, so first off, Guam is, they really didn't lock down like before, and that's part of the reason why they're still spread. The governor did try to reduce the exposure of unvaccinated people in restaurants and theaters, because they did find that there was a lot of transmission in unvaccinated individuals, and there are only like 20% of adults are unvaccinated in Guam, so the vast majority of people are vaccinated, so should be able to go into these areas. So it's been, I think, a little bit more difficult to really enforce because it's sort of on an honorary system at this point that people just have to say, yeah, I'm vaccinated. But that's the limitation. The other thing, though, that happened in Guam is they did shut down the schools because they were worried that that kids were getting infected. I think there's a lot of pressure from parents who were scared, and the governor had shut down the schools. Even though there weren't any clusters of infection associated at schools, again, most kids were getting infected from their parents. But nonetheless, it's closed. I think they're working towards finding a safe way to reopen schools. But folks are right. The number of cases in Guam has been going up. There's lots of transmission. And when you look at the numbers of folks in the hospital, it's getting closer. I think it's still a little more unvaccinated than vaccinated. But the key is to really think about what we call the denominator, or the size of that population. 80% of people in Guam are vaccinated. So there's a greater chance that of all of those 80, they have a lower chance of being hospitalized versus that small 20% is making up 50% of the hospitalization. So if the vaccine wasn't working at all, you would see 80% of people hospitalized were vaccinated because it would match the 80% of the community being vaccinated, and 20% of those hospitalized would be unvaccinated. But instead, you're seeing way more unvaccinated. So the vaccines are helping slow transmission, but what we found in Guam is having 80% of your population vaccinated is not enough to stop the spread of this Delta variant. It is highly infectious, way more infectious than other variants. It seeks out people who are unvaccinated and moves through them. So you think about Guam, 20% of the adult population is still 24,000 people that are unvaccinated. That's more than the population of Palau that this virus can get into and infect and spread. And sure, there's some spillover into the vaccinated folks, but really the number of cases in Guam has really been driven by the unvaccinated. The other thing, and I don't have all the specific data on this. This is just discussions with some of the folks who work in the hospitals in Guam, that they're finding that those individuals that are hospitalized and are vaccinated tend to be less sick and tend to be older individuals with comorbidities who may have had weakened immune systems versus young individuals who are vaccinated. It's extremely rare that they're going to the hospital. The unvaccinated folks are across the spectrum from 19 to 80, who are hospitalized. And still, if you look at the deaths, I think Guam now is maybe at 154 deaths. It's only one vaccinated person who's died. All other deaths in Guam are associated with unvaccinated folks. So it does show, one, the importance of getting vaccinated at really preventing, severe hospitalization and death. And then two, the fact that, a lot of the people who are vaccinated who are hospitalized are people who are older, who are immunocompromised, is an important point for Palau to remember. And your Ministry of Health is starting to roll out additional doses for individuals who have weakened immune systems, that their immune systems may not respond well. And so there's going to be an opportunity starting next week. The Ministry of Health and Human Services is calling we'll be notifying people who, due to their health conditions, may have weakened immune systems to come in and get vaccinated. And if you feel that you're somebody that, for whatever reason, a health condition and your age and other things that your immune system is weakened, you can talk with your doctor and see if you meet the criteria and come in and get that additional dose to add that extra layer of protection, especially from what we're seeing from Guam and those hospitalizations.
Okay, according to the report we got last week, I mentioned it to you. There's 2 U.S. territory that has been listed. They've been advised. Tourists have been advised, or the CDC is discouraging people not to go to Puerto Rico and Guam because the situation there is really bad. How is it right now? Is it really bad or getting better or what?
So I think Guam, it's still bad. We went through, just like Palau, went through the 3-day weekend, Labor Day weekend, and as we know, this virus loves to prey on the things that we like to do as humans together, and that's especially, being indoors together with mask off in large crowds. And, holidays are times that people get together, different families get together, and they enjoy together. And I think we may see in Guam, there was some decreased testing over the weekend, but we may see throughout this week some increased cases because of the Labor Day weekend. So they are not out of the woods yet. And I think across the U.S., you'll see that states are seeing increasing numbers. Some of the states that had initial high cases are starting potentially to show a decline, like is showing in Israel and what happened in India. I think you brought that up last week. So maybe we're getting through it. But right now, I do agree. I think if it's not a time to go to Guam for vacation, to hang out with family, there's a lot of COVID-19 in Guam, and you only go there if you have to at this point.
Yeah, Dr. Hancock, we got a call. Can you answer this question? Ali Gabon? Okay. Gabon, get a Karim.
Ari abri dirgul mo na
Oi.
Quasi. Algo grabo da blabro da battulo russo. Barra elang esta murió lo hace como para el booster Pfizer. Ramo russo el booster Pfizer. El galo no volver a quasi. Ramo vai dial تجد البوستر بعدها يقولوا أبروس تجد البوستر الفايزر إذا غير قالوا البغضول.
Okay, repeat kong ilusya question.
Bere hay baila ko kerang kal adra nga barde. Ibay dik ka answer tila question.
Okay, gabo.
Hindi ka kadong alwase ibe muwa booster al Pfizer.
That's what I thought.
Dito ba taklil wase umrusra next week al so din kal toktang abia kal booster umrusra 3rd dose ya kung nasa last week kada silodil wase ngani akla ka rosra 3rd dose ma booster
wase
matial bodorus ngira next week 3rd dose tial 3rd dose more tirgel adal ngari ya raktir alwal rule 3 matamo immunocompromised lo mitu tabdangirel sel ngay gel tulorus Eng dia kalwa adal masisi abadangel sel nga tulorus ngalo nga song sa segi del protection ngira gelong ayel tablo lorus gira dal masa selong de lorus el musegi del wal gora a protection ngil morbab
immune system ngil morbab
pai sel morbab mang dia kal booster a booster morar adal moraro kulat morar masisi el at el wal segi del overtime malubeng kaltatela time maigal lorus el bangay amral morio agay gidel walwa protection ngi makatong spare sa gidel booster go klamut lo ngas artial lorus mang gila ma blaktak lo ha tiang ada al booster shot 3rd dose ngede lorus yal sugum ngila orus sel kot mangeru lorus ra Moderna 3rd dose ra bumolar niya Moderna mga umrusra next week ati mother na leko madangel wasesera ko telomo lara ako telbui la dorus ako de mirusra mother na dimla ka dorusra Pfizer el molmutra ongei melbuila mga ayayid ya I hope ng lo plakatakla angir el morselgere tulig.
Okay. Berngel lu kum lang utilang arian mutel.
Ala kaya ko tumastawa dawa dagel blegel bes.
Como ngilo rens menti ad repeat.
Ay.
Alo kung ro.
Dari ul be gol be.
Oi.
Tu dai se ko kwase bom sa diak morgeri.
Oi.
Ako diak tabele dum mo basta ara.
IOC.
IOC leta boria toksio tira. Ora luror.
Makalame.
Tiagi galul bodol be kwase. Dari argil blara brigere se tala sabde blay.
Oi.
Jaldi no brek sabde.
Oi.
Ela gayidul boda kwase. Tiga gojil uluai se kwase agi blabe bla test.
Oi.
Agi negative.
Oi.
Tulgerti kwase bilgara obolara test. Esta kwase agi mor se agi airport tribus ko ba agi le. What? Eu digo, vamos por a escala, para o estreito, ok, o negativo, bram. Ela assim, seguinte, já dulce, abruria, luz, tagi lo sabi, tiga quase district gua.
Tadingi lo swap ngul mestri asem turor tolle mergom swap ngul me.
Luz, la diga badre, bugam siya.
Oh.
Yo quase siya bras, se dulce agi bruria.
Oh, okay, kim lang wa question. Kum lang userite.
Oi.
O sen ditir al selger da passenger tunga swap ngum sanga gale Q-tip sangaran pel mergot et ngulo tungira ngari ngisngire ngul mestri da hospital sen waise.
Ang waise tulik. So yegi de lomra el ngara kwamel may trigel mo testra airport ngani yegi del yel test del dulsa del waseng binax antigen testing yegi da lo spera airport ya ada self swabber ngi maluben dingil ngwa aga gidle Q-tips ngulo yera isngel ngwa a sample ngarngar adra lab mar nurs mar adra hospital ngarsay lo mesel til make sure sel ngwa a correct e bere ngida hale dogera Dr. Hancock mulsebel mutal smoothing maluben gidle Dr. Cash.
Okay.
So Dr. Hancock, they're asking about the self-swabbing procedures at the airport, and they're asking why the nurses aren't doing it and why people are self-swabbing. So if you can...
Amo dia question nga ngel lu.
Alia ibol bode, sabe pusta kera.
O han ke return sa del mutel last question ang lu lege question ra ade to in call
Arbo.
Okay, kabo.
Ela kaila ibol go asi. Arbo blabo del was tira bla advice tira. Asi disi.
Why say?
Elan ngaria ela brar kwaseya ngaria flight ngara huri pige brar ver what para pala risk belu covid gi ngaria flight brar ver bela but open the flight ver bela
Kahal ngal lu tilang mo ka beringi Olkeriil return dia.
Kahal el finish ra kanile.
Okay. Kabo ngal lu.
Algong tabla advice tira CDC ela ngaria go flight bolo pela flight ver bela rahuri pig ela toda de lo así por ahora la CDC gira seguir the flight
Charter flight.
Oh, rahuri pig ver bela su mori.
Oi.
Seguir agora.
In other words, a question was kung ngilo clearance sa CDC allowed sa igid el Malaysian Air el mira this September 12 return.
Okay, seguir.
Oi. Okay.
Tulik haldi do pagtaklil wasay kita ta kato la tour ra CDC kongyas kogil mesoy sa berbelaw.
Okay.
Oy. So as kogi charter flight tamera September 12. Oy, tegi dal ngara huriping al mel.
Oy.
El mutel mura huriping.
Say dia regular flight and charter.
Charter clothing ra masing charter flight el ngara huriping al mera 12 el mutel mahuriping.
Oy. Okay. Misal lang dia dolaya turgra CDC WHO mal ubengi dilat senga authority do bang other belao mangkida se okay pem tu et met mo wase
I see. Will tu iragal directive rigi ma aro bil protocol el bladru le
And we provided that the motrura gigi the procedure like 72 hours prior to departure. The health card tiralme they go through the same process. The diwaya the treat passengers ng Guam and May. I
see.
Okay, gadol mo.
I'll go back to the question, Dr. Hancock, about the self-swab at the airport. Maybe assure the public about the...
All right. It's a good question. So these Binax tests that we're using at the airport are a newer testing technology than the original test that required what we call a nasopharyngeal swab, and that's that swab that people may have seen and actually gone through, where the swab goes along the bottom of your nose all the way back to the very, very back of your throat. It's not fun to go through, and because of that difficulty specimen collection, it requires somebody who's been trained how to do that collection, and so thus a nurse or a healthcare provider would do that collection. These test kits are designed to do what we call a nasal swab, which is just the front part of the nose. It doesn't require the swab to go all the way back.
Oh, okay.
And so the test is designed for that. And they have found in the U.S. more and more self-swabs are the way that people are being tested, because they found that, one, it's much safer for the individual who's doing the test. They don't have to actually get up close and grab the person's head and put a swab down their nose. Instead, the individual who's being tested can do it. It's more comfortable for the person who's doing the swabbing, because they have the ability to sort of adjust the swab to where it's comfortable, rather than just having someone push in until you can't push the swab anymore. And so they actually find that people do a better job of getting the swab farther up into the nasal passage and swab. And then last, for airport testing, really wanted to ensure that passengers are able to move through that system quickly. And so the nasal swab, while it's safer for individuals, you get a better sample, it's also faster. And so the passengers can swab themselves. And again, these tests are made for those nasal testing, and so they can swab themselves and move on. And it really helps us be able to test those people quickly as they move through the airport.
That makes sense.
Yeah, and we think we agree. I mean, I personally, I think it makes sense, because otherwise, if you can't get people processed quickly in a safe way at the airport, then you have to look at, all right, do they come into the hospital the next day, and do we have them line up? And there may be somebody that's positive coming off the plane who has now spent the night in Palau, maybe with family members, or who knows, waiting. So that's why we felt if we can get a quick, efficient system going at the airport, that's going to be good for Palau. And really, your Ministry of Health and Human Services team was just outstanding in making that quick adoption of that process. They adapted, and I think it's hopefully going to help reduce the risk for all of Palau.
Yeah, even the health and caretakers of these people that coming off the flight, they don't have to be that close to them, where this is a highly contagious disease, So I agree with you in the sense that we keep try to protect the health personnel, not to be that close. That way we reduce a chance of getting sick of COVID-19. So that makes sense, really. Okay, let's get this next call. Ali ngil ko sangay?
Ay, malungil ko sangay tulik.
Oy.
Sa lugar na geril mo tira tang. Geril ngal mutation ngal variant. El mulwasing ngal variant wayal baby, wayal offspring ngal original coronavirus. Kura objektif masing ngal geril variant mal Olkeriil. Ngal original
question.
Adita rolling soy Palau al tubo ngal original COVID-19 amir belau en su el mutant su el chensa a chin trengi makomosom trengi emo inherita ngalget en spedenir al ser belau kamura ko oria total masing kora wangara prevention ng kaji del mal buku yuk
le variant may say okay sula comme il sait rite
oi I said to Liga so Dr. Hancock that's a question from the caller so their understanding is that the Delta variant is like an offspring of the original strain of COVID-19. Yeah, so they're asking what are the preventive measures that we need to apply in order to stop transmission of this highly contagious variant?
Oh, great question, and I'm glad someone asked that. So this variant, while it's much more infectious, and we find that it's able to, when you get exposed to the virus, it's a bit easier to sort of latch onto your cells and reproduce in your body and create more virus that then spills out and can infect other people. But it looks like it does transmit the same way as all the other variants of SARS-CoV-2, the name of the virus that causes COVID-19. And the primary way that it spreads is really when you're within 6 feet of someone and you're talking or you're singing or yelling or sneezing or coughing, and those drops that come out of your mouth land on that person, can land in their eye, can land by their mouth, and then it gets into their mouth or they breathe it in, and they can get COVID-19. So that's the first thing, is really trying to stay away, at least 6 feet away from individuals. The other thing we found is that some of this virus can get into very small particles when you talk or cough or sneeze and float in the air a bit. And so you may have seen recently more and more there's an emphasis on good ventilation. We find that if there's good ventilation, people are outdoors, there's wind, it's very difficult for those small particles of virus to find someone to infect. But if you're indoors with a group of people and you're eating or talking and laughing and you're all indoors, that virus can float up in the air and spread farther than 6 feet. So over and over, that's why restaurants are high-risk areas, bars, indoor bars, and as much as possible, I think really trying to do things outdoors where there's good ventilation is important. Then lastly, washing hands are important as well. That general hygiene is important as well.
Okay, thank you. Okay, Kadalwan Eriter?
Sulang ituloy kay kumdasing di tama di maran Mumbai the kukta bastrate altrigal teruru baklo mangget. Kolokora mo maskit sel kora aulaklat kalgire lagay dilgire del mokra.
Okay. Don't worry about the time. We can extend it.
Sulat tulir, pati artiang ma overdeu, agi lu meeting NEC Vice President ma IC at mula sebem bukom ter NEC mdu bebira ko mil ulaklat.
Oi.
Para dra blum kom sa ulak te al.
Okay.
Amal club lul Mr. Diasa atkal virus amoluli mangimul almer belau adi gid al نجد الأذى موقول في الممترق لذا قدول تلف لا يغلا البلال بسكيدا أوسبيتال جيد لابنور بلاو جيد مسات الله تال رقت اللي مول دي قلت له قول إن سواد المو كلوان وود الواسط تال بروتوكول process البلال قسم كلاب نور بلاو لو أوسبيتال جيد را airport أو ريور from step 1 المرة last جيد من سويس بقوبيد تمستيجرني Preventive mendiak liu, mau rior, amo ul mengimula rak, atergakles agidar at.
Masih.
Unselo subir kita hospital, kulker wasegi melmol meloreng sergamim, oi, o melmol meloreng sergamam. Mendiak liu rak. Maslo belgul abol kid rogul other belau bodo medal, del kid el momedal, amo ula garbil tial rak melak liu. Ma until Vice President udu sangbaw senior, niya chairman NEC, maalang lil NEC. Ugardewa, suadlo ay sulwa si bodo madal tial Olkeriil COVID-19. Sum komestri adel modern tri adra blimiul gileder selskogi, mo messer til mlol tirak la vek ul order surtira abelgerda. Igamam el rogul adra EOC ikmedel ngara wim el ad. Amo madala ariter el almong ingin la vice president udo luaseng ayimestria adel moregal basio la lol tirak la ya gim subdra EOC ya EOC subdra blabulis ngire la adel mom sim len tiagi da sogal duli lo opengela ogordeu ma NEC al sugum me sois parakter belau e mal dak poktul wase correct me if I'm wrong lek madengel wase correct al sis ba COVID belau en dak lo rol delta virus gagi da Dr. Thane Hancock at mo se delta virus ay misil contagious bodol aswar segid takoy bodol aswar wase katungul mo owner ngil wase ki da ganiyang ledra be kel sis el mogolgi kel gilel karakt el mogolgi Lorenzo sengu maras tabela EOC wase mlarnya positive mesois el da dorre ade mol bulul part tiang mo do electric gut moklangal alid e mo sudid ra klamrang e ngil aklamral ais klamral sud إذا قاعد يصير الدولي يعقوب بيسجد الأمد الله كلير نيل واسط كل فترة هو يبين أبود بإيري الأدل ومرا أني من ومرا أني البروسيس أوريور دي مونغ اللي يعني أسكوجي ما لوكيشن بيل ديبارتمنت أسكوجي ما aircraft أدي أبول باسيتيف تر أدل نار السيل مو باسيتيف so no matter where it comes from Tiagi del processo il ma protocol blado a planir tel blur belaura border sergidra entry gid longot mokania ad hospital tiagida adulturni e volo clormud e to remind ourselves of segil tel blur belau amla open kodo rior amla open abang over them malngania mal sum sebel fukti
so in other words asum atol malgonia amla se kerti mogergikla e de emrengi da eral tu e gida sa tajo como sei
diga kalmata COVID la blul alle dia
ai
gida mla open
wai sei
solang malungil ka pasange tulig el mergaw maradam rogui
okay
tapi mo mangarawak lagi gida blandung Olkeriil lo saging atiang al madala NEC el milisi aurerela IC riter matire gal gafar merenga sulit tegal terul toktang mar adara Ministry of Health and Social Services regid raurol blalgat makli mla motrui me el buil motrui me tiul buira magamadir tial tingela COVID segida blaldelia Olkeriil kada marail ragamang lo marail nami segida blamdelia tuligel wasia alak langarai krel egida egel ngilo el mei esera el meng mungkin mokul tial magamadil tial rak tel mesois berbelau magada salva akliming segida blantelia Olkeriil wasi bodo bek la adel ngrel eta madat ligel soba kli tial belwada malolmol melwaisel salva akl المراحل بدون مداد لين يجد نامدون التقوي mesois wa diakal dongu taada mul mesi sebi
okay e o garte o gahala do tel question atang e gorga tel question okay koler gati ngara
Oi.
Kamu ke?
Baru itu tahu yang bersama gorga bias kau ma. Ada CDC ma, ada dokter ma, rural hospital ma, Dr. Tellei ma.
Okay. NEC.
Jadi ager.
Oi.
Lego era khusus. Agera wasing. Taga malo mesetiar ke para COVID-19 na TB. Ini sa Obama na 2004 lego tel adal metro de lo mlao tiayil COVID-19.
Oi.
El wasing Alsela Fabis Rat, en Amornya Arak, short story, era alsil sekarang alsil.
Alsil.
Ba, abis kalau msugi bertia, Angel Bill Gates, Angel waktu berau ada involved bertia, mengai juga anti vaksin involved bertia. Tidak mahu Demokrat Abraham Lincoln. En agar Demokrat tok tanga soal ogestil wasi. Tapi kalau Demokrat, kalau Republikan. Oi, usulang.
Okay, there you go. I love politics. Kabo Dr. Tellei. Titules ringi.
Awai gigidel gera mal melut kara ulul riter ma kafar. Di bok sab kaltrir. Gidel adar bela ngatiang NEC ngatiang. Gidel ogul adar bela madala makamadila mesoi sabar bela.
Ngai.
Dia kalioro sing rangklel politics sa Amerikela tangara alsel. Le ama dia kado ya ka ulao edbe sis sabra alsel tiang. Gigidel derstama derstal tokol sa edel gutmok ing salab akra igam la momregal trui ma etul bui dia kal betul tokoy ablu abla bolo kay ma etul basen ar adel ma urus aktif
دي بتبتكلي الواسي جدا دي قد نغتيال مصادر politics التراق تقدر نغتيال مصادر prevention how can we survive
ويسي تولي كمان مساوي mal ungila rung sel deliti la gid legat tungklum el mortrigele del dart al adl wase kame boda dunguta lor sud tigalo gaim etul basen tra adr belaw na monguta lorus al abiagal elwid al sugum mornya tia sugu yuru rakt mangita le menga gid angal toktang al bladr ng silo ase ndirek limur tirgel lang ma urus ndin diagal sal mosme el way tirgel dirgal nga urus el mo erura kodal segida awal kelma edel mere algo besengi magi ngati al maldi mangarok lagel mlamdu o lingitra radar belaul mlar umra el me el albla bem ger del mera blu ndia ali isati al blu motirak lagel la laptop da i o sirgid e mo spert al de ngwale sira irar mo omega de sensongo bel meser gmiu ndia ka doesa madamiu el adi ma moden wal mem doesa madamiu di ili mo mrega atemiu ge emergu
amedu gutti ali mora gore e koler dingan alain
Oh iya, maluin ko saya pirga.
Kabo.
Pirga masya ilale, Dr. Hancock bukan siya. Malu kita ni say. Awai lo gol wasem, yan hal.
Oh, sel du era mo ko mofa, lagi dre kulang al TV ma radio. Kabo.
Pirga masya Dr. Hancock malu wasem. Ngora walol ko pa yung maral mo rakwam. Oy, mungil di bela ko maral rakwam mer bela karang. Sen suwel dia kalbong di rakwam masil mer bela. Tigila taragir.
Okay, good question.
Ela tigila kamento girel ngarinya. Tigel makasal population ng girel nga orus. Adigal ko na mamdas lo sa tiwel ko experiment ra gira adra ya. Tial bela ko this free. Melo lorel murus urgil bol lolas melo lobarap senber bela la senso el logro urgil lu dia la dire al mofir el mona begir al adel rar dire maim la mo complicated like that rogu el action el parangal maga de que tomese al liber sergil el mru el mo yeme okay dire dire al dire ramra suri
okay alol goringa Dr. Tellei se adra tigakhale rurtian ruli del mawakini pike الواسي غاريا الواسي تلا كوت تمنستا ترجيد او مستر جيد بسيرفر جيد مو موتي اورور مان اوبن ديا سيدا ترى كويستشن سيلي مرا كويستشن ابلا او مستر جيد سيمون مغرا كويستشن او برتي بولين سي
تولين سيمني قتل غري لا كوليرا غيرلا tiging ila ang katoktang lo sa ilang time CDC o kabayra adam dia kalbora Guam Puerto Rico hindi gari la sa ako kadal merbelan ngarak Guam so adal makatakli lo sa igel sel directive al time malblakatak lo sa adal me giren la marus rogul adal mail ngarba barkira 12 giren la marus mua test ra edel klubsera within at edel klubsera angas asko ginmay sellamay egada test tiri airport taygi del blol meregal smodia o gordeo ma Olkeriil lol ngitra adra blul se daga ing selo maklat kertir gaygi del albebi rigi del mail lo se gomo tirak la gaygi del el gimol ngitra gmiu lo se gom mga sada la bisira at sela blu di kera gel ngaringi qabli miu o mask de kabum gedra ngal del diga kalorus el aimet klubse mengungel logerul testra a hospital ay gidera tama do marang alwaseng ngaringil masabah karigid al sugo marak tami igiten na mesa tulig lo se trigel terul positive amlamo erul sunday ralme matang lamo direct lamo ngara erul dar tamadring el atame since ra tirgay gidil terung amadang still dirga kalmut talbes el gays el madang of course kada mesra kada malmon malo mesra situation ra Guam direct kabir ra marigel al sugum gyom das lo sing namo gidel kuk ngoto iya process kadam kuk mga dura officer president tama NEC lo sa kami do mesra telo sa makara kuk tore ringin mo sabah kerja mong kada malmal lo pas sige the process o mesringi mong ilat time sabi ira adal nga rakwa may hindi giri lo tirak lay gigi el blato turco closing teletele la protocol ra amesoy se revela nga akwa malung model belu sa long erulgere tuliga oy maral ang anyar bebi ra adal kora mora rundi om da society aglel kora experiment tengah raktel hindi kita lo mes news tial rak tadi akal ngaringil rak dalam kuadra adra ikel belau hatta kadala ko telgib telgida kamata del dia kada sara belwat dia kada saring lama kodal sila belwat alwa wa belu rakwam hawai mamrigel makadala ko ra mora rarungud lo singara makduk mal ko ra ngatiang al mimok kulmuru legel swadal muru eniat to mes news ng gorawal tingin mato mesra katsudol ko ramal kloaring ilma kodal la ikel bela unding suadal el selba akla ul mong agunda sa omsin dara atam na mga oros sa umral wasing maran nga niya bulgul kung rat to ko maran may tiarak ta ikda selba akla ra kodal ma
Siya mo one more ko okay ali caller kadir ngatila
Oy, aknak tiang.
Oy, kabo.
Tulik kau ma doktor watri ko mga farmer to ang doktor.
Oy.
Ya ka ba la pix.
Oy.
Ay nga issue Amerikano albang al omes.
Oy.
But yal belaw ay ga yidin open rashi mi close wasi disma NEC. Ay nga kami kung ka ba dito may politics na ang subit ko sa diyan politics ay ga. Hindi rin small ay ga yidin mo mo ngay. Ya may yidin ko gen nila toktang small mo ngay. Kumsulang.
Oy. Kabong, kang hanya inser nga kanmorsen di bote kapar ka amedsen.
Kaya kang malmasawla ko lere, man marat to ko sel boda kalakal lomes away gigi kada mangan mo klo around ring ra adra bululo se ga kalel ko radi kloko el politicians marmaraw adra igal mo klol bulua uspe ringil ko ra obigit lo mong may mong kada understand ra concern ra ko ler I'm sure in atakal din ngita hindi kumda se tulig hindi akal gida dalom ko siurgi may gagi din maklol bulu especially to ko ra politics kada mes ringing ko ra mo klobulong sel bal mo do bal mo lelak lo tabaringi lo sa igal maklol bulua takakawadal gida la ang rak lama madal ngara malgeda kara ngaret maram tamlamor sa igid point tamlamo o makamadal ma pag titakang gira lama madal dopan mirang ngaret gida ngat tangat tiling la klasyo ka ngarigid matetele da kukta ka dasal mor sa igid mo o mondaira ko ramal gigrit to koy mo kada understand ra ko ler hindi akum daswing ang gira del mo timo kargik le mo o klorungut o mi atoil mo sel la terigi de marco embu accept terigi mal
kafar kamiu sel gumester kamiu kamiu aprovet ya cristiano ko mara biblia ya biblia lo aruba kan lang ay katingin la aruba kan ngara biblia mangdiwa sel do el mulla sei imol maasen loriael bravo misel mas al mora ave me helicopter me laringi embergoen en atin bang mas emberwasak mangira ruba embergo ya kora pol oral en mail pun mokotir morpa pol WhatsApp se ngara mak mingir ka rupa ka ko me ase sel helicopter el black center ngi le kong senga o magmiu abrobet lo dru lo ndara expert mengira men do reng nga ka adigi arura ngokla sa ko marat ngela Dios le nga ka cristiano ndia question at ngela Dios metirgal adan bruta galurura meltut kra Dios el momru ngi expert magugululo orgid lo asebos at least the rings protect yourself malakam contaminate society dengan alsel ma community transmission adia kan statil statik kagel belum se edel ma para mal di grebel ta medit pa di tolngit tula se pot se lo reng sa igagi del instructions ma scientific facts lo lablo mskit ya igadi hat tigingira wa kapar tigingira melom sengar serba be durok men merkit me please se bom nga orsmi wasugum dirga complete tra chapter ka okay komeng kapar
ya kamsulang tulik wala dong simira kumda sa toktangal ang ani ako ra tublot tokol saldi mo
nelgo
Oh, thanks. Yeah, I just thanks, Mr. Diaz. Just you know me, my apologies. When I get going, I have a lot of things I want to say. So I appreciate you moving me along. But I wanted to re-emphasize for our community in Palau that although I really encourage everyone to get vaccinated, I also want people to really be aware of that additional treatment that's available for folks on Palau if you do wind up getting COVID-19. Or if you're exposed to somebody and you're for whatever reason not vaccinated and you're somebody that's high risk for being hospitalized, there are those, we call them monoclonal antibodies. The other name for the medicine that's here is called REGEN-COV. And again, it's been provided by the U.S. government to Palau, and this medicine really helps reduce the chance that you wind up having severe COVID-19 and going into the hospital. And so the important thing is you need to get it early. So once you you start having symptoms, and if you're somebody who's high risk, who's older, somebody with diabetes, somebody who's maybe carrying a bit more weight than they should, if they're obese, those sort of things, be ready that if you do unfortunately get COVID-19, that this is available for you, and you have to come in early to get it. So please, if folks that are listening, remember about this REGEN-COV, this therapy that's available early for individuals who test positive, who are high risk. Spread the news. Think about it for your parents and grandparents if they do get it. It's just another tool that we can do to help fight COVID-19 in Palau.
Okay. Kafar.
Okay. Thank you, Dr. Hancock and Dr. Cash, once again for joining us. Sulang ukodeo kam Olkeriil, lukuk matala isil me mangali me katakay nga sir tial reled magiman nga sulit direct. Ang adimos timor segi de tulik at sumal digiagere kamring asuler bekta te kimring asulem adara ngarel belaw.
Okay.
Makuk next talk show gid.
Okay. May igang ma next Thursday.
Tulang.
Momesa balwal mabli takol